Do you ever feel like you only get sick on the weekends or when your primary doctor isn't available? When this happens, where should you go? Dr. Jared Stone with Lexington Medical Center is here to discuss when you should go to urgent care versus the ER and some common summertime illnesses that you want to be aware of. So Dr. Stone, it is great to have you.
Thank you. Thank you for having me.
And you know, summer is fast approaching, so families are going to be out moving around. You know, kids are going to be spending some time outdoors as the weather changes. So first, let's just kind of go through some common illnesses or injuries that, you know, parents could expect to see this summer.
Sure. Well, we all want to get outside, and with the sunshine comes sunburns. I recommend covering up, getting some sunscreen, trying to prevent the sunburn in the first place. This is a burn to the outer layers of the skin. You can treat it with simple things over the counter like aloe vera or Tylenol and Motrin for the pain. Sometimes the burn can get more deep to the skin and form a blister. Try to keep that blister intact. If it opens up, cover it up with some antibiotic ointment to prevent infection.
Also with the summer months, Dr. Stone, heat cramps and dehydration could be a big problem. Talk about that.
Sure. Heat cramps occurs from dehydration. Usually it's when people are outside exerting themselves in a hot environment. It's not a serious condition, and it usually resolves when you go inside, cool off, and drink some water and other electrolytes like salt. Dehydration can also result in heat exhaustion. In a similar instance of you being outside and doing some work when it's hot out, you should go to a cool environment, stop the activity, drink plenty of fluids. Heat exhaustion may present with some nausea and vomiting. And if you're not able to hold fluids down, I recommend getting checked out at one of our advanced urgent cares.
And that could also become more serious heat stroke. Can you discuss what that is specifically?
Absolutely. Heat stroke is very rare, but it is an extremely serious condition. It is when the body temperature rises to a serious level from high environmental heat exposure. People are typically very confused or maybe even comatose. They need to be seen immediately in the emergency department because it can result in severe organ injury or failure.
And lastly here, Dr. Stone, you know, kids being outside, playing, having a good time, broken bones can also be common.
Very common. Broken bones can be hard to distinguish from maybe a sprain. You have bruising, swelling, and pains to that area. If you're concerned, you should immobilize that area by keeping it still and preventing further movement. I recommend getting checked out to see if you need an x-ray.
And talking about when you're going either to the urgent care versus the ER, what with these illnesses would be okay to go to the urgent care versus the other?
Sure. So any type of minor illness or injury, for example, nausea, vomiting, upset stomach, those can be managed in our urgent cares. Our urgent care is a lot like the emergency department in that we offer extended blood work, other tests and capabilities. We have x-rays, CAT scans, ultrasounds. We can administer IV fluids and other medications, and even do simple procedures, managing lacerations with suturing or other techniques, and managing the broken bones. If anything is serious, for example, if the broken bone is bent in an abnormal shape, it's poking through the skin, or you have other serious trauma, you need to be seen in the emergency department for anything that is life-threatening.
And talk about, do you have to make an appointment for the urgent care, or are walk-ins welcome?
Sure, walk-ins are welcome, just like you could walk into the emergency department. No appointment is needed at the urgent care. The wait is usually short, but you can go online to the www.lexmed.com/care now. You can check the wait, see the nearest location, and even reserve a spot in line.
What are some things that parents should do as far as keeping certain safety measures or safety kits at home?
Prevention is key, as we talked about with sunscreen, but pools are a big concern this time of year. So for little ones, make sure that you're keeping an eye on all the people around the pool, as we want to prevent any kind of harm in that environment. In terms of things at home, Band-Aids, antibiotic ointment, we talked about sunscreen, any basic first aid kit is good to have on hand.
We definitely want to make sure that all the kiddos enjoy this summer. These are some excellent tips, Dr. Stone. We'll have all of these full tips and a link to this interview on our website at WISTV.com. Thanks, Dr. Stone.
You're welcome. Thank you.